We all want that perfect smile, right? But what happens when that desire pushes right up against the boundaries of medical ethics? Today, we're going to dive into the really tough choices dentists have to make when a patient's request puts the art of looking good in direct conflict with the science of being healthy. It's a huge question, and it feels more relevant now than ever. So, to really get a grip on what's at stake, we've got to look at what happens when the hunt for a specific look goes to the absolute extreme. All right, so first up, you've probably heard of Justin Jedlicka, famously known as the human Ken doll. We are talking about an incredible number of procedures. Nose jobs, implants just about everywhere you can imagine. It's this constant journey of modification, and it's really a stark example of someone pushing their body to the absolute limit for a very specific aesthetic goal. And it's not always about achieving some kind of perfect human ideal either. Take Jocelyn Wildstein, who the media often calls Catwoman. She's said to have spent millions of dollars on surgeries to get a more feline-like appearance. It's a pretty powerful reminder of just how personal and complex the motivations behind these choices can be. Okay, I know what you might be thinking. A human Ken doll feels a million miles away from your local dentist's office, right? But the underlying ethical problem, it's exactly the same. Just think about the trend of getting permanent vampire fangs, where people actually ask dentists to file down and reshape perfectly healthy teeth. This is where that aesthetic desire smashes right into a dentist's duty to, preserve health. So 150. Just let that number sink in for a second. That's 150 separate cosmetic procedures for one person. 5 nose jobs alone. We're talking about a level of body modification that raises some really serious questions for the medical professionals holding the scalpels and the drills. And that really gets to the heart of it, doesn't it? Are these highly trained professionals healers who took an oath to do no harm? Or are they just service providers whose job is to give the customer what they want, no matter how extreme it is? And look, these high-profile cases don't just live on social media. They have a real-world ripple effect on how we, the public, see the entire medical and dental profession. It can start to shift our view of a doctor from a trusted healer to, well, more like a mechanic for your body. And that is the central fear for so many within the profession itself. They worry that by participating in these extreme makeovers, it devalues their skills and their core mission, which is to heal and restore health, not just to cater to every aesthetic whim. Because when people see these crazy cases, the fallout is huge. That fundamental trust you're supposed to have with your doctor, it starts to crack. You begin to question their motives. Is this about my well-being, or is it just about the money? And that shift in perception can damage the image of the entire profession, not to mention open the door to all kinds of lawsuits when those extreme expectations aren't met. But wait a minute, is it really that black and white? Is any procedure that's not strictly for physical health automatically unethical? Well, to answer that, we kind of have to step back and broaden our definition of what health actually means. For the longest time, medicine had this really simple, narrow view of health. If you're not sick, you're healthy. That's the old biomedical model. But that's kind of like saying your car is perfectly fine just because the engine turns on, while totally ignoring that the tires are flat and the windshield is cracked. The modern view, the biopsychosocial model, is way more holistic. It gets that true health is this complex mix of our physical, our mental, and our social well-being. And listen, this isn't some newfangled idea. This definition comes from the World Health Organization way back in 1946. The key takeaway here is that health isn't just about not being sick, it's about the presence of well-being. So if we accept this bigger, broader definition, well, then the whole game changes. Suddenly, aesthetic dentistry can actually be ethical if it genuinely helps a patient's mental or social well-being, like if it gives them the confidence to stop hiding their smile. The goal isn't just to fix teeth, it's to improve a life. Okay, so if some aesthetic work is fine, but the really extreme stuff isn't, how on earth does a dentist figure out where that line is? They don't just guess. They have a kind of ethical compass, a set of core principles that helps them navigate these really tricky decisions. These are the 4 big ones, the pillars of modern medical ethics. You can think of it like a mental checklist for any tough call. First, autonomy. Does the patient have the right to make their own choice? Then beneficence. Is what I'm about to do actually going to help them? Non-maleficence, and this is the big one, am I doing any harm? And finally, veracity. Am I being totally 100% honest about all the risks? A good dentist has to weigh all 4 of these every single time. But here's the kicker, and this is so important. A patient's right to choose is not a blank check. Just because a patient asks for something, it doesn't mean a dentist is obligated to do it, especially if it violates that core principle of do no harm. All right, enough with the theory. Let's make this real and put this ethical compass to the test. We're going to see how these principles work in a super common, everyday scenario involving porcelain veneers. So picture this. A 21-year-old walks into the office. Their teeth, totally healthy, totally strong. But they see a few tiny imperfections, and they are dead set on getting a full smile makeover with veneers. Bam! The dentist is now staring down a classic ethical puzzle. Now, before we even talk ethics, let's talk biology. To put on veneers, you have to permanently shave away up to 30% of a perfectly healthy tooth. That enamel, it's gone. Forever. And this idea that they last a lifetime? Nope. One study found that almost half of them might need some kind of work done within just 10 years. This is a major permanent alteration to your body. It's a big deal. So let's run this through our ethical compass. Autonomy says, yeah, the patient can ask, but the dentist has to be brutally honest about what that means. Non-maleficence, do no harm, is a huge red flag here. You are literally destroying healthy tooth structure. Beneficence makes you ask the hard question. Does this small cosmetic improvement justify that huge biological cost, especially when there are less invasive options? And veracity ties it all up, demanding total honesty. You can see how these principles really start to pull in opposite directions. So how do you make the final call? Well, a lot of dentists use a mental tool that looks something like this, a harm/benefit matrix. Down here in the bottom right, you've got stuff like teeth whitening, low harm, high benefit. That's an easy yes. Up in the top left, you've got high harm, low benefit things like vampire fangs. That's an easy no. In our veneer case, it lands smack in the middle of that tricky, murky gray area where a dentist's professional judgment is absolutely everything. So what does it all boil down to? It's this. A dentist's job is to be more than just a skilled pair of hands. They are the expert in the room, and their primary duty is to the patient's long-term health, not their short-term wish list. If the harm outweighs the benefit, they are ethically obligated to just say no, even if it means turning away a paying customer. And that brings us right back to where we started, to that central challenge. In a world that's obsessed with the idea of perfection, that line between making a life better and causing real, permanent harm, it's getting blurrier every single day. Deciding where to draw it, that's not just a problem for dentists. It's a question we all have to grapple with.